Where is Iran today with the corona crisis? Well, the country's back to work for one thing. Low-risk stores and businesses in the provinces reopened on April the 11th, and a week later, Tehran province had its businesses reopened after a month. Offices have 2/3 of civil servants present at work, with the remaining 1/3 allowed to stay at home, and health workers and scientists are at the front, battering to hold the fort. Iran is fighting the coronavirus and a US sanctions virus, as the Iranian government put it. But then it's not the first time Iran's fighting an enemy and a shadow enemy at the same time, and it's become creative at doing so. To hear of Iranian innovation and achievement in fighting the coronavirus or COVID-19 outbreak, stay with me, Leila Faramarzi, on Iran Today. Iranian doctors got to work trying drugs by case study. Dr. Soleimani is a medical researcher who comments on their method.
I can tell you that, in particular, Iranian doctors are really very good at that, in order to do whatever they can to treat their patients. And because of that, I think they didn't just sit down and just looking at the existing algorithms of treatment or the existing evidence, because there was no evidence. We didn't have enough evidence to show which treatment is efficient and which one is not. So what can you do when there is no evidence? When you say there is no evidence, that does not mean that what you might do is not effective. That means that there is no evidence that it is effective. So there is a difference. A physician, in time when he or she thinks that something can help his or her patient, can do that intervention, but later on should design proper research projects in order to evaluate the efficacy of the treatment that he or she has used.
Plasma therapy alone has so far reduced coronavirus deaths in Iran. For convalescent plasma therapy, someone who has recovered from a coronavirus infection donates their blood plasma to a patient. 3 weeks after Iran's attempt, the United States started working on plasma therapy, and after, European countries began, looking to share Iran's experience. As for medicines tried and passed, Dr. Hashemian of Masih Daneshvari Hospital has a lot to say. What are Iran's latest achievements with regard to COVID-19?
About the pharmaceuticals, we have good companies in Iran. They are good. The big pharmaceuticals and our friends in their companies are working very nice for Iran. For example, about the hydroxychloroquine, it's not available in the United States. And lots of Americans, they're getting these pharmaceuticals from the pet shops. I remember one of my friends in the United States called me and they told, how about the chloroquine in Iran? And I told them, we have lots of chloroquine in Iran and we have no problem to getting the chloroquine for our patients. But it is due to the big companies working on the pharmaceuticals here in Iran.
In the war against the coronavirus, this microscopic organism, as with wars between men, he is bound to win who can regenerate weapons. Avigan is a Japanese anti-flu drug. It is being tested in China as a treatment for COVID-19 or the coronavirus. And Iran has been administering it for COVID-19 in health centers such as Masih Daneshvari Hospital. Results have been satisfactory. And now Iranian pharmacologists have succeeded in synthesizing this drug with the generic name favipiravir. In working our way backwards from cure to diagnosis to prevention, we got to hear of how Iran is doing with treatment machines as well as diagnostic kits. Dr. Allahveran is both physician and general.
Thanks to the extensive knowledge that exists in the Ministry of Defense, we were already producing suction machines and heart rate monitors which are currently used at hospitals, especially at ICU departments. I am proud to announce that the country's private sector is currently manufacturing enough ventilators, and this has already relieved the extensive need in our hospitals. In addition, the Ministry of Defense has the capacity to produce ventilators independently, and I imagine that in the near future, the Ministry of Defense will move in that direction.
Apparently, Iranian kits now diagnose patients for COVID-19 with over 95% accuracy.
We had conducted studies on our diagnostic kits, and as a result, immediately after the breakout of the coronavirus, we started producing COVID-19 diagnostic kits. Fortunately, around 40 days ago, we managed to produce the first samples of these kits. However, they needed to be approved by designated institutions. Without further ado, they were approved and distributed among the relevant coronavirus centers. Thank God, the production of these kits by the Ministry of Defense is in progress strongly. There is no limit in our production volume. However, we have the capability to produce 50,000 kits per day. The key point is that our products are molecular identity recognition kits, which are way better than the so-called rapid test kits. The accuracy and efficiency of rapid test kits have somehow been disapproved by the Ministry of Health and the WHO.
The first COVID-19 pneumonia diagnosis system unveiled in Iran uses the artificial intelligence algorithm to take a CT scan of the chest. This system can detect abnormalities which cannot be spotted in CT scan images in the early stages. It can calculate the volume of the infected zone. Prevention is better than cure, however, and the stay-at-home directive to break the chain of contagion is as important as ever. The government, however, thus far doesn't have the funds to pay people to stay at home to maintain social distancing. What it can do so far is pay people bonuses and handouts such as a 10 million rial or $66 low-interest loan to the lowest income families. Also, people who are going outdoors will have to observe all health protocols, and it's up to trade unions and the health ministry to make sure these are enforced. There is a speculation that with New Year holidays ending and so many people getting back to work, contagion will actually make a surge later in April. So I asked why it was important to lock down the country for the holiday month and not now.
I think in about early March, it was the first few weeks of March, which is equal to Isfan in our calendar. What happened is that suddenly you had a surge in patients. So number of patients increased rapidly. So all those patients could make new patients, could transmit the virus to other people. So that was a danger. And imagine, instead of 10 or 20 or 100 people transmitting the virus, suddenly thousands of people transmitting the virus. So it's like an exponential curve. And it suddenly takes everything out of hand and results in chaos. And also the health system will collapse. So that was the worry. And that was when we had to make the decision of locking down and everybody. So by social distancing, by asking people to stay at home and by keeping them away from where they come together, what happened is that we cut the transmission. And at that time, it was absolutely necessary to do that.
But now, should there be a surge in the infection curve, how might all the medical know-how and staff suffice, was my next question. Iran has 1.9 nurses for every 1,000 people, according to World Bank estimate. And should it be possible to produce all required drugs and equipment, the country must need raw material from abroad. This is where sanctions should be a nuisance.
تحریم‌هایی که به هر حال
Given the sanctions imposed directly by the US and indirectly by the EU countries, I can safely assume that any country other than Iran would have collapsed and failed to control the spread of the virus under such circumstances. The good thing about the Iranian nation is that they have a kind of a spirit which shows itself at the time of crises. That spirit makes them united in a magical way. Due to the sanctions, we can import ventilators and other medical equipment easily. But as the world witnessed, all military and non-military organizations together with people joined hands in the fight against the coronavirus and the US sanctions unanimously. We made a lot of sacrifice. People are producing masks and other safety gears at home to fill the void left in the market these days by the surge in demand.
Iran has requested an emergency loan from the IMF, International Monetary Fund, however, a loan of $5 billion to fight the virus. But the US plans to block the request. Calling the US's acts medical terrorism, President Rouhani said, "We are a member of the IMF and we have paid into the fund like other countries. And we have a right to have access to this support." Time for a quick break. Let's take a look at what other media outlets have to say. For that, I give you Shahrzad.
Hi, my name is Shahrzad Manucheri, and this is the news section of Iran Today. We'll be looking online for the latest update on Iran's recent efforts and achievements in the fight against COVID-19. In an article by BBC, we take an in-depth look into the coronavirus and how Iran and the US trade blame over sanctions. With Iran one of the countries hardest hit by the coronavirus, a war of words has broken out over the impact of US sanctions. Iran says they're hampering its battle with the disease, but the US denies that and says Iran has mishandled the crisis. We have repeatedly said that US sanctions do not impede Iran's response to the COVID-19 crisis, State Department spokesman Morgan Ortagus said on the 1st of April. Iran faces a number of problems in buying medical supplies internationally, despite the exemptions for humanitarian goods. Only a few Iranian banks can access the international banking system. Lengthy and complicated legal compliance for business trading with Iran, a $500,000 equivalent to €400,000 limit on US export licenses for exempt food and medical items, and a sharp drop since 2016 in the number of export licenses for specialist medical equipment, some of which might be needed to treat COVID-19 patients. IFP News claims it is not easy to attribute corona outbreak to biological terrorism, says Iran. Head of the Health Department of the Iranian Armed Forces General Staff says it is not easy to definitely assert the coronavirus is a human-made one, but the issue is being studied at scientific centers. Brigadier General Hassan Araqizadeh said no one can say for sure if the virus is human-made. However, considering the evidence, it is a matter of doubt, and all countries are investigating. The issue is also being studied at Iranian scientific centers, but it is not easy to confirm this scientifically and with certainty, he added. The Deccan Herald states Iran parades medical gear for Army Day amidst coronavirus outbreak. Iran paraded disinfection vehicles, mobile hospitals, and other medical equipment as it marked its National Army Day to underscore the military's role in battling the coronavirus pandemic, which has hit the country hard. The Small Defenders of the Homeland, Helpers of Health parade, held at a training center before a group of commanders in face masks, was a far cry from the typical Army Day parades, which normally feature marching infantry, missiles, submarines, and armored vehicles, with warplanes flying overhead. Due to health and social protocols, it is not possible to hold a parade of soldiers. The enemy is now hidden, and doctors and nurses are at the front lines of the battlefield, President Hassan Rouhani said in a message to soldiers disseminated by state media. Army Chief General Abdulrahim Musavi thanked the more than 11,000 military medical staff who are fighting the coronavirus. That's all for this segment. We'll see you next week.
While all countries are afflicted and find they have to look out first for their own people, a little I'll scratch your back, you scratch mine mentality could go a long way. Once Iran gets its manufacture going, others can also benefit from this country.
Are there countries already that have asked to buy our medical equipment from us, kits, etc.?
بحث صادرات در ارتباط با کیت‌ها مطرح شده.
The issue of exporting our domestic kits has been raised recently. Some countries, around 5 to 6, have so far asked to purchase Iranian diagnostic kits, and we are determined to put them on sale as soon as the conditions are right. There is no need to say that sales agreements will be signed, and we will make sure to receive the money. I may also add that our primary concern is the domestic need. Export comes next. But with regard to our production volume in this field, we have the potential to export, and we will not face any shortage of diagnostic kits.
Also, securing Iran, this crossroads between East and West against sanctions and therefore the virus, can help keep safe its borders and beyond. A group of 24 senior diplomats and defense officials, including 4 former NATO Secretary Generals, have urged US President Trump to save potentially hundreds of thousands of lives across the Middle East by easing medical and humanitarian sanctions on Iran. We'll be alternating to hear what Iranians also think of sanctions in relation to the corona crisis.
Sanction is both an opportunity and a threat. So I think the opportunity part of it is really important. So we have to I mean, maybe this is on what I'm just now telling you is my own assessment. I think overall, I don't see sanctions as a handicap at this moment. Maybe many years ago, when we weren't prepared like we are now, sanctions were more, they could play a more important role in depriving us from some of the facilities. But as we went forward, one of the things that sanctions did to us was that right now, we just simply do not wait for anybody. That's a very important notion.
The bipartisan group of 24 is not pressing for a generalized lifting of the sanctions, but instead a targeted effort to ease US rules that prevent Tehran trading in medical and humanitarian goods. The group says reaching across borders to save lives is imperative for our own security and must override political differences among governments. Signatories include former U.S. Secretary of State Madeleine Albright and former Director of the International Atomic Energy Agency, Hans Blix, and support is worldwide. The signatories urge Trump not to use America's voting rights on the IMF board to disrupt an Iranian request for a $5 billion IMF loan and to issue a statement supporting the use of Instex, a barter house. This instrument in support of trade exchanges created by the UK, France and Germany in 2019 allows European companies to trade with Iran without exposing themselves to secondary US sanctions. As an example of secondary sanctions, just recently Iranian Health Ministry spokesman Jahanpour said, "The SWIFT code for Iran to buy extra diagnostic kits from South Korea was cancelled." Seoul announced that this was for fear of US sanctions.
I think the sanctions was a very big problem for the medical equipments nowadays. I think because lots of procedures we are doing in the ICU or in the hospitals related to the medical equipments. And I don't know about the future, but nowadays we are good in this manner, and we have good machines that in our facilities.
Instex came up due to the US breaching the JCPOA or nuclear deal in 2018 and banning global trade with Iran. Now, given the global pandemic, insisting on sanctions may only tarnish the reputation of the US and Europe in the eyes of the Iranian people, pushing them into the arms of Iran's non-Western partners, the group fears. While Iran is already allied with Russia and China. The thing is, food and medicine are exempt from US sanctions, but global companies and banks are reluctant to deal with Iran for fear of US retaliation. Also, certain medical supplies and equipment are not exempt. To sell protective items to Iran, such as full face mask respirators and some decontamination systems used to sterilize them, companies need a special license from the US Treasury Department. And the Trump administration has reduced the number of licenses granted to companies that export medical supplies to Iran, according to the Washington Post. Donald Trump's hypocrisy doesn't fail to entertain. He has expressed readiness to send Iran ventilators, while at the same time banning other countries from shipping medical goods to Iran. This way, the US would remain the sole savior, getting Iran to plead for aid, hence throwing Trump a winning card for upcoming US elections. Or so he would wish. Because Iranian Foreign Minister Zarif responded, Iran would soon be prepared to send ventilators to the US, if the US would like, of course. Mohammad Javad Zarif tweeted the US president, "Iran will be exporting ventilators in the next few months." The Iranian foreign minister was referring to machines sorely needed in hospitals but rare in most countries following the corona outbreak. Zarif advised Trump to stop interfering in other nations' affairs, especially the Iranian nations. "We will accept no suggestions from any American politician," said Zarif. Iran has vowed to protect its people from the economic impact of the coronavirus. Estimates show 15% of Iran's economy will be affected by the coronavirus outbreak, according to Economy Minister Deshpasand. To maintain a balance between health and economy will not be easy. Iran says the priority will always be given to health policies, however, and that everyone, even those without insurance and even foreign nationals, will be covered for corona medication and care for free. There is a relatively small down payment to make, however. While America's message of help now rings hollow, well, the superpower hasn't even been able to help itself, really. Iran has taken to Russian President Putin's proposal of a green corridor. The green corridor would be to transport essential goods and technologies without sanctions as the world continues to battle the coronavirus pandemic. I gave some examples of Iran's achievements, but the country doesn't intend to stop at that and is looking to join the global effort for a vaccine.
There are different aspects to this disease, COVID-19. The immunology, the diagnostic part, the treatment part, and also the support that you provide, but also the preventive part and how you can prevent the disease, and also the vaccine. I think vaccine area in our country, that's my assessment, I might not be right, but my assessment is that area is a little bit ignored and a little bit neglected, and maybe because it's a really difficult area, but maybe in the future, when we learn a little bit more about the genetic blueprint of this virus, maybe we can have a better idea of how we can provide vaccines.
The president sounded a lot more optimistic, said he. On the basis of the studies carried in Iran and exchange of experiences and research studies with other countries, Iran's experts and physicians have fortunately been able to get close to the behavioral patterns of the virus and ways to contain its outbreak to a large extent, which is highly significant. Minister of Science Gholami has called on genetics and biotechnology research teams at universities to work on containing the disease and developing vaccines with new methods. Also, Rouhani ordered the Health Ministry and the Vice Presidency for Science and Technology to conduct a study on the use of a new diagnostic test kit for detecting people with immunity to infection.
That's it for today. Thanks for staying with us. But like I said, there's a whole new angle on the story to cover. So do watch at the same times each week for more on corona and other stories. And don't forget to leave your comments and topic requests. Bye for now.